because I know it's so precious. The agenda today is that we'll give you an overview of Telea, and apologies to those of you who have heard some of this, especially if you came to Navan, but some of it is not repetitious as well. And we're going to look at the impact in Laois Offaly, and I'll do a Q&A, and then Carol and Jason, well, I think Carol will be given the presentation, we'll talk about scaling up and readiness and work involved. And just to say, like, it's so refreshing to work with digital health team. I think it's a lovely marriage, actually, speech and language and digital health, and I think we'll work really well together as we scale up over the region. So hope you feel the same as we work through the process. And then at the end of the session, I suppose hopefully you'll know all about what Telea is, but there will be more training, obviously, and you'll understand the time and effort involved in kind of integrating it into our business as usual, and evaluate your own readiness. And Carol will give us some guidance around timelines. So hopefully you can all hear me, because when you're presenting on Teams, you can't see too much. So just to set the scene, I suppose I'm very mindful that you're taking time out of your busy days to listen to us today. And just to set the scene for where we were in Laois Offaly before we commenced this pilot, because I suppose this all came from a pilot, and now this pilot has been scaled up. So I suppose, just to be very honest and real about it, I felt more like a chaos coordinator than a speech and language therapist some days when I came to work, a lot of days. And we all know, I don't have to tell you, that the healthcare system and environment is volatile, uncertain, complex and ambiguous. But I hope that we have something, a tool, I guess, that's going to assist you in this healthcare environment that we work in. So just to say why I really believe in this digital platform so much is that it's very unique. It was actually co-designed, it was transformed during our pilot in CHO8 Laois Offaly. So a lot of the features that now exist on it are there because therapists like you in CHO8 said this is what we need, and patients also contributed a lot in terms of co-design. So this has been designed for us, you know, with our local context in mind. So that's a very unique position to be in. And I suppose we know from national conferences and all of our strategies in the HSE that the focus at the moment is enhancing accessibility to healthcare. And this platform should assist you in that regard, in terms of making things more efficient and protecting your time for those who need it most. And yeah, so just, I think this kind of secret sauce for me is that most of the features on this platform are actually added in response to suggestions made by clinicians and patients in Laois Offaly. So I suppose, like, I just want to acknowledge, I think we all come from a similar experience in that the demands way exceed our capacity as speech and language therapists, and that's unlikely to change in the context of, you know, an international HSCP recruitment and staffing crisis. But the beauty of us as SLTs is, as a profession, we are so committed to continual improvement. So even when you're 50% staffed or less, which we were, you know, during our pilot, we still managed to, I suppose, achieve some improvement. And I see that in you all, because I actually know you all, and I know the brilliant work that you do. And also this, I suppose, initiative is really in keeping with the principles of Sláinte Care, and it's moving us in that direction. So from my perspective and from the HSE's perspective, when we bought into the pilot, we wanted to address the high level of medical and psychosocial risk, which is associated with our lengthy waiting lists. And we wanted to prevent avoidable disability. So I'm going to give a little overview now on Telea. And if you ever heard of Telea Therapy, that's the same company. But they just rebranded because of confusion around their name, and I agree. So just to set the scene a little bit, in 2022, the Health Innovation Hub Ireland would have done an open call to new startups, and Telea Teletherapy at the time were selected by the Health Innovation Hub as eligible to participate in a HSE pilot. And then I, on behalf of our department, approached the Health Innovation Hub and managed to secure ourselves in Laois Offaly as a pilot site. And actually the fantastic news, and I suppose a benefit of linking with Carol McCann and the digital health team, is that they assisted us to work towards actually achieving successful procurement of the Telea platform now for our whole region. So that was, I suppose, a fantastic outcome for us, and it's very exciting now to try and progress it across the region. So I suppose it was very different work for me, and I think different work for you all, in that there was a public and private element to it. And then, just for your own information, apologies if you know this already, but Health Innovation Hub Ireland are jointly funded by the HSE and Enterprise Ireland. And now we're at the stage where we're trying to work with the speech and language therapy managers around rolling this out across the region, which is really exciting. Okay, so just to give an overview of Telea, and I think most of you probably know a lot about what it is, but with regard to the pilot, it was a 9-month pilot. Up to 50 patients took part in the pilot, 10 speech and language therapists took part, and to date over 90,000 exercises have been completed by patients in Laois Offaly. So that's a lot of speech and language therapy, you know, when you think about it. So how does it work? Well, essentially, it's a digital online platform. It allows a speech and language therapist to prescribe bespoke, life relevant exercises to optimize a patient's communication output. The clients tell us they really like it because they can log in the comfort of their own home on their mobile or tablet device, and they're guided through a set of, you know, very life relevant prescribed exercises, and they know they are being monitored by their HSE speech and language therapist. And just to say, I suppose I alluded to it already, through the pilot, the benefit, I suppose, for the company was that because of the huge amount of co-design that went on and the patient involvement, the platform was transformed from just being basic lauda drills to incorporating cognitive linguistic exercises and, you know, I suppose a more extensive suite of exercises, which you'll get to know about now when you do your training and get to use the platform. So I suppose from my perspective as a therapist, it's different, it's unique because we can prescribe bespoke, person-centered motor, speech and linguistic exercises, and we can perform data analysis at the click of a mouse. Gone are the days of the reams of sheets totting up averages with your pen and paper, and it prevented a need for a high number of face-to-face appointments to do LSVT style therapy. A fantastic feature as well for me was that we actually built in a feature to listen in, which negated the need for separate review appointments, that we could just dynamically evaluate how a patient was managing at home and listen in to what they were saying and how they were saying it. And then the patients were telling us they liked it because it was functional, it was person-centered. They felt empowered, they were driving their own treatment proactively, which is really in keeping with the principles of sláinte care. And I suppose we are engaging them as partners in their own healthcare delivery. And that's the way the HSE is going. So I just sat back and I thought, well, what difference did it make to me? So I suppose from my perspective, it sped up access for clients to speech and language therapy appointments. We needed to complete fewer face-to-face appointments. Where we did complete face-to-face appointments, they were shorter and more holistic, meaning obviously you weren't spending the whole session on the motor speech. It did free up time maybe to do dysphagia work as well, and still the sessions were shorter. Obviously, I was having to travel a lot less, and I spent a lot, you know, obviously there was cost savings there as well, but time is the big saver. And I know your scarcest commodity is your time. An interesting side effect, perhaps unintentional, was that the communication between us and our clients was really enhanced, and the clients were initiating more contact with us, kind of as a side effect of this digital platform that we were using. Maybe because they were more empowered, but also because they were more inclined maybe to text or tell us, I was in hospital last week, so I couldn't practice, because they felt we were watching them. So I already mentioned the ability to review dynamically, which was a good time saver. Prep time was greatly reduced as well. I used to spend hours photocopying, and people could have speech and language therapy anywhere and anytime. That's just a kind of a view of what it looks like from the patient end. It's really easy to use, easy to read. You can't go wrong. It's very easy to train up your patients to use it. It's very, it's intuitive. It's designed with the needs of people who might have thinking changes in mind, and we would have made significant changes there. Or people with visual perceptual difficulties should find it accessible in general. And then you can see here, like, you can get a nice clinic overview, which is very helpful. And obviously we'll go through this more in your training with Telea, but I just wanted to give you a feel for what it looks like if you haven't seen it already, and many of you have. So again, you can see, like, an interesting feature there is the sticky note, which once the patient opens up their app, the sticky note is there. And I often use that actually for appointment reminders, because I found with this population, sometimes they did tend to forget to come into their clinic appointments. So that's an interesting feature that you can use. And I loved that I could analyze sessions at the click of a mouse. I'm not a big fan of mathematics, so it was all done for me. And very helpful, and lovely to have that quantitative data. You can print all this off. It's easy to print and stick it into the file. Saved me a lot of writing and time. So I suppose I sit here today, and this is my biggest excitement. I suppose there's huge potential to scale this up to other patient groups. And I suppose initially you'll use it with Parkinson's and Parkinson's Plus, because obviously that's what it was built for. But as you get comfortable, absolutely, you could use this with people with other motor speech disorders after stroke. I'm going to start trying this now. I would have done it months ago, only the ethical approval of the pilot prevented me from moving outside of the Parkinson's population. But you can imagine yourself, with the features I've described, you would be using these with lots of other client groups. So for example, people with mild dementia, they would definitely benefit from this. People with ABI, people with aphasia, there are linguistic tasks on there that you could prescribe for them. You might be prescribing some exercises, but not all. But the beautiful thing is that this is completely tweakable, and you are in charge. So you're just prescribing exercises as you always did, but they can do them on their phone and you can listen in. I would have also tried using this with people with MS or MND had I had the ethical approval. I think it would have worked, and I look forward to doing so in the coming months. So the impact, I suppose, just to say, like, the Health Innovation Hub, the beauty of them is, I suppose, they're quite independent. And we got some of this feedback from interviews they conducted, and some feedback from kind of other data we gathered throughout the pilot. And also, obviously, we had to prove that this was value for money and try and write a big business case and all of that. So some feedback that we received from our own clinicians, like yourselves, is that from the dysphagia perspective, they felt the patients were really benefiting because they were getting more time to do dysphagia workup and refer for video fluoroscopy, which, as we know, can be really time consuming. Another therapist commented, "This is revolutionary. It's like nothing I've ever experienced, and it really enhanced my efficiency." And it's really nice to hear feedback like that, especially these days in a volatile healthcare environment. Another therapist commented, "I no longer sit for many hours with these clients doing loud style therapy. I can bring them in, I can focus on the loud style therapy for about 5 minutes of the session and trust they are doing that at home. And then I can focus on other things that the app cannot address." And we know, due to our dual role with dysphagia and even the cognitive linguistic element of things, that an app cannot address some of those issues. So we need to free up our time to do those things ourselves. From other feedback from clinicians, I think this was probably me, in fairness. I can't go back to the way we used to do things. And that's where I started reaching out to find Carol. And we, obviously just to get support to try and keep doing this good work, because it would be really hard to go back once you have a tool like this. Another therapist said, I see lots of opportunity to use the platform with people who have other motor, speech or voice conditions. So I suppose that's interesting to some of you who are sitting there who might say, well, I don't have loads of people with Parkinson's, but actually there could be other people on your caseload with whom you may use this. Another therapist said it was very easy to use and very easy to learn, that they wouldn't be overly tech savvy, but it did transform their model of service delivery. I thought this was a really interesting one. I just read it in the Health Innovation Hub draft report. It's due to be published very soon, and we'll circulate it when it is published. But this therapist had noticed that the generalization of the exercises happened quicker than with the traditional therapy approach. Now, that's only anecdotal, but it is, it's promising to hear that. And then when we think of the voice of the people with Parkinson's, because they were central to the success of all of this, and they were just noticing how much the app had improved since they first started using it. And I suppose that was very empowering for them. They were making suggestions, but within days they could see that what they had suggested was being put into practice. So that was very empowering for them. Another gentleman said, it made me think, and making me think was excellent. Another person commented that it was so mobile, and no matter where they were able to use it. They were using it on holidays in Spain, or when they were admitted on respite. Their therapy did not have to stop. Another person said they find the app very beneficial because it deals with all the components that are necessary in maintaining and improving voice quality. It encourages better compliance with the exercises. The cognitive exercises are especially good and often challenging. So I suppose this piece was very important when we had to meet senior leadership team and try and campaign to get this funded. So there's loads of service level outcomes that we could prove. So for the population with whom we were using Telea, we were able to reduce our home visits by 60%. Even though we were 50% staffed across all of the services in OPS and ECC, we eradicated our Parkinson's waiting list. But I do take the point that this was a pilot, so an artificial situation. We could prove that per therapist per month, we could actually see 400% more people with Parkinson's per therapist per month for intervention. So because of the enhanced efficiency, really, you could carry a bigger caseload safely. And also therapists were interviewed, and it was found that per therapist per month, 12 additional hours were available for dysphagia management. And that was helpful because we could do a health economic piece and show that that could prevent bed days acutely in terms of our dual role as speech and language therapists. And after the initial assessment was completed, in the past pre-pilot, sometimes patients had to wait 6 months for their first therapy. And that was greatly reduced to about 2 weeks. Again, because I suppose therapists could see more people with Parkinson's per therapist per month because they could do so more efficiently. So that was a huge reduction in waiting time for intervention. And then I already talked about spending less time in consultations and them being more holistic. So that was about 50% when therapists were interviewed. They were spending 50% less time in face-to-face consultations where they did have them. And there's a huge time saving in planning resources because, again, it's click, 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 print rather than reams of paper. And much less paper needed because obviously it's on the mobile or tablet device. And then our waiting time for assessment reduced, but again, during the pilot. So they were some significant KPIs, benefits across all of those on the list. I won't go through them again because they're a little bit repetitious, but you'll get a copy of these slides. So it's nice to have those. And I suppose I know this group, you've a high standard in terms of what is evidence-based. And I just to say, like, we take that seriously too. And there should be 4 research papers coming out of this work that has been done. And I suppose as well, we've had to get the word out there in order to get this procured and in order to get funding and the backing of the senior leadership team in CHOA to pay for this for speech and language therapy services. So things we did was we went to the ECC conference, we would have presented at ISLT conference, and then just to say there will be a 60-page Health Innovation Hub Ireland project report, and that should be published, I would imagine, within the next 2 weeks. So we will share that with you when we have it. And again, that's done kind of, I suppose, in a very unbiased way by the Health Innovation Hub Ireland. And I just wanted to give an example because I think sometimes you might think, oh, you know, if I work in a nursing unit, I mightn't have use for Telea, but actually this was an example of a patient. I knew him years ago, I don't know him anymore, and fictitious name John, but he is 74 and he has advanced Parkinson's and dementia, and he attends the daycare centre in Birr a day a week. And he has been using Telea with the support of his wife and speech and language therapist since May 2023. Now, just to set the scene, that man's speech was not intelligible, even to those of us that were very familiar with him, and he would have been using an alphabet board as a supplementary aid when he was speaking to enhance his intelligibility. So you can see there, obviously I've outlined, you know, his session plans, very simple, drills, functional phrases and naming. And when I took a look, I could see in June 2023 that he was achieving 10 sessions of practice in 2 weeks, which is a high dose of therapy that we could never have replicated with the staffing that we had in the CNU. And again, when he came into respite, the therapist was freed up to do a dysphagia assessment rather than having to do both. So that was very helpful. Then he had an episode of medical deterioration and he disengaged with the platform and his practice ceased. But then he came back spontaneously himself and reinitiated a very consistent practice from October. And now he is speaking without the need for an assistive communication aid. He's speaking verbally and fully intelligible verbally. So that's an amazing outcome considering he's living with a progressive disease. He has dementia as well as Parkinson's. And actually, you could see there, we used the ramp, the TOMS and the grubbus, all of those had improved. So a lovely outcome for him, but he may need a little bit more support from his wife in order just to get set up on the phone or the tablet that he's using at home. It's just a slightly different model. And then in primary care, we had a range of people ranging from their 50s to their 90s. And when the Health Innovation Hub Ireland came to interview them recently, nearly all of the clients said they had a positive experience using Telea, and over 80% of them found it easy to use. And when they were surveyed, so they had to complete surveys as well as meeting with the Health Innovation Hub, over 95% of the patients said that they wanted to continue to use Telea, which is kind of why we looked for funding to keep this going. They appreciated being part of innovation and they found it more interesting than traditional modes. So that's interesting. They appreciated being able to practice anywhere, anytime. And when we looked at the grubbus, the ramp, and we had 2 TOMS outcome measures as well, on average, Health Innovation Hub compared them at baseline and at the end of the pilot, the 9-month pilot. So each patient would have had about 6 months access. Across the grubbus ramp and the 2 TOMS scores, they had all improved on average by about 10%. And when we bear in mind we're dealing with people with progressive condition, that's quite impressive. And the huge number of therapy hours saved because people are empowered to practice well and frequently at home. And over 80% of clients reported that they were more likely to complete their prescribed exercises with the benefit of Telea. And the average was 62 per week. And that'll be all outlined more in the report. I just stole that out of the draft report there for your information. So just to finish up from my perspective, it did enable us to do more in a tough situation. It did empower our patients, and I know you're really interested in that. It did enhance our access to speech and language therapy services, and it did save time, which is the biggest one, and also costs, which helps us to prove that it's good value for money. And I might stop sharing there because I think there's time now for Q's and A's.
Okay, I'm just going to stop recording just for anybody who doesn't like to hear themselves